Well, the disease that we are dealing with is a form of polycystic kidney disease, which is called autosomal dominant polycystic kidney disease. That means that is transmitted from parents to children, and that is enough for one parent to have the disease for the children to have a 50-50 chance of inheriting the disease. Okay. Now, it is important because it's the main or is the most common inherited cause of end-stage renal disease worldwide, and overall is the fourth most common cause overall of end-stage renal disease. And the disease is characterized by kind of a relentless growth of cysts within the kidneys that destroy the tissue and then cause hypertension and pain and other complications, and significantly impair or have a negative impact on the quality of life. The treatment for PKD has been, until now, treatment just of the complications. So healthy lifestyle, dietary interventions, trying to control cholesterol, controlling blood pressure are important, very important. But there is no specific treatment that has been available for patients with polycystic kidney disease. This study what has shown is that a drug named tolvaptan, which blocks the action of a hormone called vasopressin on the kidney, is capable to slow the growth of the cyst in the kidney, able to slow the decline of kidney function, and at the same time lower the frequency of complications like pain, bleeding, and urinary tract infections. The issues with this type of therapy is that by blocking the effect of vasopressin on the kidney, patients have high urine output, so they need to go to the bathroom more frequently than they would otherwise, and because of that they have to drink more water. So that's the main issue. But the large majority of patients have been able to tolerate the medication quite well. In terms of unexpected findings, we have found that in a small percentage of patients there is an abnormalities of liver enzymes that occur. So at least for the initial period of treatment, it's important to keep an eye on these liver enzymes to be sure they are staying within the normal range. The study is important for two reasons, or at least for two reasons. One of them is that the first therapy specifically directed against polycystic kidney disease that has been shown to have a beneficial effect. And the second one, because it shows that if you can slow the growth of the cyst, this also is capable to slow down the decline of kidney function and the occurrence of symptoms like pain and bleeding into the urine and urinary tract infections and other associations of polycystic kidney disease. Now, this is kind of a first step, it goes beyond a proof of principle, but is a first step. This treatment is hopeful for the future, but is not at the present time a treatment that can be right away gone to clinical practice, because the treatment has not been approved by the FDA, at least for the time being.